Good morning. I'm Dr. Wolfthal from the Lakeville Animal Hospital here in Lakeville, Massachusetts. It's a beautiful day outside, but today we're going to be inside and we're going to talk a little bit about skin disease in dogs and a little bit in cats. This is Abby. Abby is a middle-aged corgi. She's one of our regulars here, and she's a really, really cute girl. Say hello to the folks at home, huh? Hi, Abby. And to be very honest, there's absolutely nothing wrong with Abby's skin, but we're going to use her as a demonstration, and then we'll talk a little bit about skin disease, and we'll talk mostly about allergy in dogs. Now, when you have a dog or a cat, you want to have a nice, bright, shiny coat, and Abby certainly has that. It's very normal to have a lot of hair come out of the coat when you brush. People always say, my God, you know, I brush and I brush and I brush and I have a whole nother dog. But the dog is not showing any signs of hair loss. There's no bald spots. But if I keep brushing her, I'm going to get little bits of hair falling out of my hand, and that's completely normal. It's also very normal when you go to the doctor for your dog or your cat to shed more. This is a normal stress reaction. Things to look at home, okay? You want to look, part the fur, look down at the skin. You shouldn't see anything other than hair where it meets the skin. You shouldn't see any crusties. There should not be excessive dandruff. A little bit of dandruff is perfectly all right. It's completely normal. You want to look in your dog's ears. The ears should be clean, pink, and most important, empty. There's not supposed to be anything in the dog's ear. That is a perfectly normal, happy, healthy ear. Hi there, sweetheart. There's nothing wrong with your skin here. There's not supposed to be any redness or irritation. Yeah. Okay, sometimes what will happen is they'll get irritations on their neck where they have heavy skin folds. And these skin folds stay kind of moist and they get irritated. The other thing is sometimes the collars themselves can cause an irritation. So you want to check in here. Hi, sweetheart. Can you hold still for just a second? We're going to check your feet. There we go. And again, in between the toes, nice and clean. The nails are nice and clean, nothing out of the ordinary. You want to look for fleas. Fleas, of course, look like these tiny little, very rapidly moving bugs crawling through your dog's fur. It's very common for animals to have a flea or 2 or 12, and for the people not to be aware that it's even there. Not all dogs will scratch like heck when you have a flea issue. It's almost impossible for a dog to completely avoid fleas throughout their lifetime. What we want to avoid are the dogs who react really, really, really severely to the fleas. These are dogs that are called having a flea bite allergy or a flea bite dermatitis. And that used to be much more common. The newer flea products, I won't say have eliminated that, but they've made it much less common, although we still see it very, very, very often. So we're going to talk a little bit about abnormal skin with a little bit of an emphasis on allergy. Skin should never be red or irritated. Your dog, like all critters, is going to scratch every now and then. Everybody's allowed the occasional itch. What you don't want is a dog or a cat that lives to scratch. There's an obvious problem with that. Everybody can have the, as I say, occasional itch, but if you're scratch, 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 itch, 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 that means there's something wrong with the skin. The most common things that will be wrong with the skin are redness, irritation, that shouldn't be there. Crusting. Crusting is usually a sign that there is something wrong with the outer layers of the skin. If you have really deep bubbles or big red areas that are oozing, now that's even deeper, that's a sign of a deeper infection. And of course, fleas can cause all of these things. Another thing that you will sometimes see in dogs and cats is ringworm. So if you have a dog or a cat that has itchy skin, crusty skin, red skin, irritated skin, This should not be allowed to continue. If it goes on for more than 1-2 days, there's something not quite right. It should be checked out. So ringworm is a possibility. A superficial skin infection is a possibility. One of the really common things that we see, and unfortunately there's no good way for me to show this, there's no diagram for it, are skin allergies. And these can be very, very, very severe. They're not life-threatening directly, but they can be life-debilitating. Okay, how do you know if your dog has an allergy? Most allergies in dogs, as opposed to in people, are skin issues. People, when you think about the allergic person, you think about the runny eyes and the runny nose and the hay fever, the coughing, the hacking, the sneezing. Dogs can get that, but most commonly, if you have a dog with a skin allergy, with an allergic problem, these are going to show as skin problems. And the reason for this is the cells that cause the allergic reaction. In people, they're concentrated in our respiratory tract. In dogs, they're concentrated in their skin. So the dog either inhales something or eats something that it reacts to, and now the dog is itchy as heck. And you can have facial reactions, bright red. It can be in the abdomen, very common in the abdomen. It can really be anywhere. Sometimes it's feet. Very often it's just ears. So you take your dog to the doctor, and the doctor says your dog has an ear infection, and you treat the ear infection, and it gets better. And then when you stop treating the ear infection, it comes back. So you treat it again, and it gets better. And you stop treating the ear infection, and it comes back. This is a very, very, very common scenario for dogs, and sometimes cats, with allergies. Okay, groups of allergies. What can cause an allergy? There are several big classifications. Fleas are a classification all by themselves. So you have to be very, very sure that you have your flea issue under control. If it's not under control, guaranteed you're not going to find out what the dog or the cat is allergic to. The second really big group of things that dogs and cats can be allergic to are things they inhale. Grasses, trees, pollens, these are seasonal. House dust, that's not seasonal. So this is a patient that's going to be itchy all year long. Feathers, pillow stuffings, all of these are things, believe it or not, that your patient, your dog, your cat, my patient, can be allergic to. Essentially, if a human being can react to it, a dog can react to it. Dander, of course. And yes, we all know of people who are allergic to dogs and cats. I have one dog client, dog patient, who is allergic to human dander. I don't know what to tell that dog. I guess I have to tell them they have to get rid of the owners. It doesn't work that way, of course. But we do have one dog that is actually allergic to people. And we have another dog that's allergic to cats. Obviously, avoidance is wonderful, but it's not always possible. Okay, so we have inhalants. We have fleas. The other big category is something that we are eating. Now, very interesting, food allergies only affect about 15% of all allergic patients. So that means 85% of the time you're talking about a patient that is allergic to something they're inhaling. Okay, flea allergy. Very easy to diagnose. You're taking a look at the dog, the cat. If you're loaded with fleas, you've got a problem. See your doctor. They will talk about what to do about the fleas. What about the flea allergy dog or cat that only has 1 or 2 fleas? Well, if you're allergic, 1 flea bite every 30 days can be enough to drive you nuts. So your flea control is absolutely positively vital. That means treating the pet every 30 days, treating all the other pets in the household, whether you think they have fleas or not, at the same time, and it means treating the house, whether it's with premise spray, a handheld can that you're spraying around the house on the areas where your pets spend time, or evacuating the house, and setting off flea bombs, or getting a professional exterminator in, or doing all of the above. It all depends on the severity of the problem. We're not going to talk about individual flea and tick control products right now, but it is something that you can discuss with your doctor at any time. So fleas, issue by themselves. Inhalants, that's the biggest single component of allergies in dogs and cats. And yes, they can be allergic to tree pollen, grasses, weeds, molds, fungi. All of these things are inhalant allergies that can create a problem. The best way to diagnose, is my dog allergic to something that I'm inhaling or something they're inhaling, is with a skin test, very similar to what they do with people. Me personally, I'm allergic to grasses and trees. Very severely allergic. If it's green, I can't stop coughing, hacking, wheezing, and sneezing. How did they test me? They did what's called a scratch test. You sit there in the doctor's office like this, and they make these little scratches on your arms, and you can't scratch at them, of course, and they wait to see how great the reaction is, the wheel, the reactivity that you get on your skin. That then determines what you're reacting to. You can do this to a dog or a cat. It's very expensive. You have to shave half the patient. The patient has to be anesthetized because most patients will not hold still for this. This is not something that your average doctor can do in their clinic. This is something you really need to see a dermatologist for. It is considered the gold standard. Fewer veterinarians, even dermatologists, are doing this because now we can get some pretty accurate results with blood testing for inhalants. Now, the blood testing most doctors can do in their office. The blood test ideally should be a fasting test. Get the serum, send it to the lab. Takes anywhere from 3 to 7 days to get the answers back. In most cases, you'll get a printout which tells you what groups of things we're reacting to and how strongly are we reacting to them. Once we know that, the next step is to make a serum that's designed specifically for that patient. And that serum is given either as an injection or as oral drops, very long term. And yes, we teach you how to give the injections at home. It's not something that you need to come to the doctor for every 2 or 3 days. And just like people, you get an injection, small dose, relatively frequently. Over time, the dose gets a little larger and the concentration gets a little stronger. The spacing between the injections gets a little larger. We try and sensitize or desensitize the patient to that allergen. The goal is to get to the point where you're giving 1 injection a month. If you can get to that, that patient is really well under control. How long do you do that for? Well, if you can get to 1 injection a month and the patient is not itching and scratching and the skin looks normal and we're happy, eventually will vary from doctor to doctor, we'll say, let's see what happens when you don't take this any longer. That's what happened to me. I haven't had a bad season in a long time, and that's what we do with a lot of our dogs. However, that's the goal. Doesn't always work. We have one dog. He's getting his injections every 3 weeks during the winter, and he's perfect. But during the summer, when there's more pollen, grass, trees, stuff like that out there, he reacts more. We can't go more than 10 to 12 days between injections. And at that point, when that summertime starts rolling around, the owner just gives him injections more frequently, and he's fine. And then in the fall, we start spacing them out more, and we get back to once every 3 weeks. Wonderful, he's under control. Now, the newer method, which has only been around, this is August, December, not this past December, the December before, so it's been around for about 1.5 years, are oral drops. We've tried this on a couple of patients. Works on some, does not work on others. Obviously easier because you're just putting the drops directly into the dog's mouth. The drawback here is this is a twice-a-day medication for the life of the patient. There is no end point. If it works, it's very easy. You just have to remember to give the drops twice a day. If it doesn't work, that does not mean the injection won't work. It just means that this patient either cannot tolerate or just doesn't work on that individual patient. So that's our quick talk on inhalant allergies. Food allergy. As I said earlier, there is no blood test for food allergy. The only way to diagnose a food allergy is you have to do a food trial. This means that you can only use the food that your doctor recommends. Why what your doctor recommends? Okay. Allergens, the things that make you allergic, are always proteins. Proteins are really big molecules, really big molecules. So when this protein enters your body, either from I'm allergic to fleas, so I'm reacting to the proteins in flea saliva, or I'm allergic to something I'm eating, the protein in whatever it is that you're eating hits your immune system. Think of your immune system as a big safety net. Triggers the safety net, all the alarms go off, and you have an overreaction. Your body is overreacting to something that isn't really harmful. That's an allergy. So if we know that it's something that we're eating that's triggering the reaction, we need to try something that the patient has never been exposed to before. Never. Since we're trying to eliminate proteins, that usually means using a novel protein diet. Novel meaning new protein. Beef, chicken, lamb, these are all parts of just about every dog food on the market. So you need a dog food that doesn't have beef, chicken, or lamb. Okay, they make some with fish. There are some with venison, rabbit, duck, kangaroo. I think there used to be one on the market with alligator. We used to use lamb almost exclusively because almost no dog in the country ate lamb. Well, the pet food companies discovered that, veterinarians are prescribing lamb for these dogs. Let's put out some lamb diets. Great, now every dog has been exposed to lamb and we can't use lamb and rice, which was our classic hypoallergenic diet. Can't use it anymore because almost everybody's been exposed to it. Okay, if you're going to use a novel diet, what you do is this. You take away everything that that dog or cat has been eating, and I mean everything. And the only thing you're allowed to eat is what the doctor tells you. And you do this for 60 days, 60 days. That means no cookies, no snacks, no treats. If you have a dog and a cat in the household, better make darn sure that the dog can't get at the cat food. No kitty crunchies. Whatever that patient eats can remain in the system for a full 60 days and keep the allergic reaction going. So that means if on day 3 of this 60-day trial, or let's make it worse, let's make it day 20 of this 60-day trial, your dog gets into the cat food, guess what? We have to start from day 0 again. Isn't that fun? So none of this stuff can get into the dog. This also includes chewable heartworm preventive because they are beef flavored. You either need a non-chewable pill or what you need is one of the topicals. I like the topicals because there's nothing in there that's going to trigger an allergic reaction if you have a food allergy. Can they trigger skin reactions? Sure, but no more or less likely than any other reaction that you would get with any medication. So you're doing this food trial. You have water and the diet, and you do this for 60 days. What happens is this. Here's my standard description. Here is your itch level. It's supposed to be down here. So people think, okay, this is what's going to happen over that 60-day period. It's gradually going to get better. But it doesn't work that way. Remember, the allergen you eat today can remain active for up to 60 days. So that means that your itch level is going to do this. And then somewhere in that 60-day period, it's going to be like somebody threw a switch and it's going to fall off the table. It's going to be like that. All of a sudden, my God, my dog stopped itching. So with a true food allergy, you're doing the food trial. Dog's at home. 2 weeks go by. Nothing has changed. I'm still an itchy, miserable dog. 4 weeks go by. At this point, the owners usually say, doctor doesn't know what the hell he's talking about. There's something very wrong here. 5 weeks go by. Ah, this is ridiculous. This is terrible. 5.5 week, all of a sudden the dog stops itching. Literally just like that. Now, in the old days, people would say, well, you have to confirm it, so you have to feed the diet that he was itching on again and make sure that's what he's reacting to. I don't know too many clients that are willing to do that because we've just determined that we've got an allergic dog. Now we want to make him miserable again? That's really hard to sell, and I can understand that. I would not be willing to do that to my dog. So if you have a food allergy, you've now determined, okay, I have a food allergy. What do I feed my dog? Well, most of the hypoallergenic diets can be fed for life. The alternative is we add one thing back in. Example, let's go back to the chewable heartworms, which may be flavored. Are we having a reaction after doing that? Good, we can stay on the chewable heartworm. Let's try an over-the-counter food that may be a fish and potato food. Well, that's a little scary, but let's try that. Oh, we can tolerate that? Great, I don't have to use this expensive, and yes, they are very expensive, veterinary diet for the rest of my dog's life. Why can't you use a fish and potato over-the-counter diet to begin with if you really are truly thinking you have an allergy and not an intolerance? Because most of the over-the-counter diets are milled on the same machines that make other diets. When you're using over-the-counter diets to try and eliminate a true food allergy, you may not be, in fact, you probably won't be successful. And once you've determined I have a true allergy, then begins the battle of what can we eat. That is a whole different topic. The last group of allergy is contact allergy. You're literally reacting to something that you are touching. That's not very common in dogs and cats at all, but it does exist. The classic example in people are the people who react to wool, or the people who react to certain metals. For example, some people can't wear gold. They'll get a reaction on their fingers. Some people react to wool. They can't wear wool socks. They will just itch like heck. In dogs and cats, it's a contact allergy. Again, it's always where the contact occurs. So these dogs or cats will have allergies, redness, irritation on their feet, or usually on their tummy where they're lying down. It's a pretty easy thing to eliminate because all we do is keep the dog or the cat in the animal hospital for a day or two, and the problem goes away. So then we know that they're reacting to something they're touching at home. Then it becomes elimination. What are you touching that's causing the reaction? And we can discuss how to diagnose that when we see that. I've been doing this for a long time, over 30 years, and I think I've seen one case of a true contact allergy. It's not very common. So I hope that everybody's been a little bit more comfortable talking to their doctor, or will be a little bit more comfortable talking to their doctor about possible allergies. Because the signs you can see can range from, I have a chronic recurring ear infection that just won't go away, all the way up to, I'm absolutely miserable, I'm scratching, I'm digging, I just can't survive. Now there are some newer medications out to help some of these dogs, and we should talk about that other than just allergy testing and allergy treatment. Short term, steroids are the mainstay of short-term treatment, but they are not a good idea long-term. Steroids being cortisone, prednisone, they're all part of that family. The side effects, drink a lot, pee a lot, eat a lot, sleep a lot. Those are the short-term side effects. Long-term, bone disease, diabetes, liver disease, it's not something you want to do long-term. But short-term, you may have to. Antihistamines. Yes, antihistamines can help, but they don't always help. Histamine plays a big role in people allergies. It doesn't play that big a role in dog and cat allergies. So if you give antihistamines to a dog or a cat, it may help. It may do absolutely nothing except the dog or the kitty goes, oh, treat? Oh, good. But it won't harm them. There are other drugs. Atopica is one. Atopica is cyclosporine. Very effective for a lot of dogs, quite expensive. So we tend to go a lot easier, or I should say it's a lot easier for people with little dogs to deal with. Yes, they make a version for cats as well. Big dogs, sometimes Atopica is so expensive that it's just not financially feasible for a lot of people to do. But it is out there. It is something to remember. There is a brand new medication out there. It's called Apoquel. I love this medication if I could get my hands on it. I can't believe the company did this. They actually put it out there, told veterinarians about it. I tried it on one dog that was absolutely miserable. Actually, I should say this dog went to see the dermatologist. The dermatologist suggested we try it. We did. It worked. It got us to the point where the dog can now live until the allergy shots kick in. The dog is now on allergy shots, and believe it or not, yes, it is working. Somebody asked the question, is it possible for a dog or a cat to have a one-time reaction to something? Sure. Classic example, bee sting. And you get swelling and red and itchy. You may even get hives. And they break out all over the body or even in one area. Treatment, cold compress. Time, often goes away by itself. That is a case where Benadryl will help. Benadryl for dogs and cats, the general rule is 1 milligram of Benadryl for every pound of critter. So if you have a 40-pound dog, you're going to give him 40 milligrams of Benadryl. That's a lot more than a human would take. It's okay. Dogs are dogs, people are people, the doses are different. So I hope I've helped explain a little bit about skin allergies. Any questions, please feel free to call the animal hospital, 508-947-1309. Of course, you can always talk with your own doctor. See you next time.